More than 2,500 Hoosiers remain hospitalized with COVID-19, continuing a trend in the state not seen since January. Indiana also announced 4,100 new cases of the virus Friday and added 31 deaths, bringing the total to 14,615 since the start of the pandemic. Health officials continue to stress the need for as many people to get vaccinated as possible. We're joined now by Dr. Sean Granis. He's the Vice President for Data and Analytics at the Regenstrief Institute. He's the author of 2 major studies on the effectiveness of the COVID-19 vaccines. Hello, Doctor. Thanks so much for being here. Now, as we said, you're an author of the published study on the effectiveness of the vaccine. What did the study find?
Sure, absolutely. The first study that we looked at was published in the New England Journal of Medicine, showed the baseline effectiveness of all 3 vaccines, and that effectiveness was quite high. People who were vaccinated were 10 times more protected than those who weren't. Unvaccinated individuals were 10 times more likely to be seen in the emergency department with COVID or be hospitalized for COVID. So this study was done with over 40,000 hospital admissions, over 20,000 emergency department admissions across the country. So it showed that excellent baseline performance. We then went on to study the effectiveness as the Delta variant came on, and there were concerns about the effectiveness of the vaccine there. Our study published last Friday showed that while the effectiveness has dropped 5 to 7 points, that still corresponds to 5 to 7 times the protection of not being vaccinated. So again, people who are not vaccinated are 5 to 7 times more likely to be showing up at the emergency department and not be hospitalized. And one of the things we want people to understand is that vaccines aren't only designed to prevent infections, they're designed so that if you do get infected, if you have a breakthrough, your symptoms are less severe, the consequences are less severe, and you don't show up to the emergency department or get hospitalized.
Now, the Biden administration has mandated vaccines for all federal employees and businesses with more than 100 employees. Is that a step in the right direction?
Well, I think what we want to see is more people vaccinated. And so to the extent that we can find ways to effectively do that, I think that's important to slow the spread of the disease and to slow the consequences of being infected with the COVID-19 virus.
Yeah. Now, Indiana has about a 50% vaccination rate, and much of the hesitancy is in those rural areas, which kind of mirrors what we're seeing nationwide. So how do you get more people to buy into the vaccine?
Sure. I think we need to meet people where they are. I think we need to understand why people might have hesitancy or concerns about the vaccination. I think we need to continue doing what we're doing right now, which is to get the information out there on how profoundly effective these vaccines are. Even at the slightly decreased but still amazing effectiveness that we've recently seen, that is much more effective than even the typical flu vaccine. So we want people to understand that the vaccine is safe and incredibly effective and continues to be so.
One more question. There's trials going on for vaccines for children 12 and under. What's the difference between the vaccine for adults versus kids?
Sure. One of the primary elements that they're going to be looking at is the dosage. So sometimes the vaccine dose for children may be less because obviously they're smaller, tend to be smaller people. So what every vaccine trial does is it wants to identify that optimal or ideal dose that is most effective. So primarily what we're looking for is to understand what the appropriate dosage is, but we're looking forward to getting initially an emergency authorization and then ultimately an approval.
Okay, Doctor, thank you so much. Have to leave it there. Appreciate your time.
All right, thank you.